Complications associated with type 2 diabetes. This video explains some of the most important complications of type 2 diabetes and what can be done to prevent them. If you have type 2 diabetes, you are at higher risk of high blood sugar levels, high blood pressure, and high cholesterol. This is an unhealthy combination that can lead to damage to the large and small blood vessels. When you have type 2 diabetes, it is most often the larger blood vessels that are affected. One of the things that can happen is a narrowing of the blood vessels, because fats in the blood stick to the inside of the vessels, which makes it harder for the blood to flow. This causes poor circulation throughout the body and increases the risk of blood clots. The higher your blood sugar levels, blood pressure, and cholesterol is, the faster the narrowing of the blood vessels happens. The small blood vessels can also be damaged. The thin blood vessels in our eyes are particularly sensitive to high blood sugar levels. After many years of type 2 diabetes, high blood sugar levels can result in damage to the small blood vessels. This damage can, among other things, lead to changes in the eyes, and for a very small number of people it can cause impaired vision. A similar thing happens in the kidneys, which clean our blood. Here, the blood flows through very fine blood vessels, which are damaged over time by high levels of blood sugar. The result is that the kidneys slowly lose their ability to clean the blood. Finally, the nerves can also be damaged by high blood sugar levels. The longest nerve pathways are particularly vulnerable. This can lead to a loss of sensation in the feet, which increases the risk of developing foot ulcers. Nerves to other parts of the body can also be damaged. For example, those that go to the heart, intestines, bladder, genitals, and skin. Complications associated with type 2 diabetes develop slowly. It can therefore be difficult to detect that you are ill. You should make sure to have regular checkups with your doctor, as this allows you to work together to prevent the development of complications and to detect them early so that treatment can be started. In addition to consulting with your doctor, you should also regularly have your eyes checked by an ophthalmologist and your feet by a podiatrist. It is also a good idea to inform your dentist that you have diabetes. Fortunately, not everyone with type 2 diabetes develops complications, and there's a lot you can do to prevent them. The most important thing is that your blood sugar, blood pressure, and cholesterol are kept at normal and stable levels. To do this, it is important to eat healthily, exercise, and avoid smoking. Finally, it's important to take the medication as prescribed by your doctor. This will also help prevent or delay the onset of complications. You can read more about complications associated with type 2 diabetes at Videncenter for Diabetes.dk. Thank you for watching.